Hi, my name is Jeff LaCour. I'm an ear, nose, and throat physician at North Oaks ENT and Allergy. I trained ear, nose, and throat in North Carolina for 5 years, and then after that I did a special year of studying under one of the grandfathers of sinus surgery in Savannah, Georgia. And during that year we studied the disease processes of nasal and sinus disorders and the treatments, including complex surgery and simple surgery. And today I'm here with one of my patients, Miss Yvonne Downing. Thank you for being here, or thank you for having me.
You're welcome.
Who I've been treating now for a few years, and particularly about 2 with regards to your sinuses. And Miss Yvonne, if you could kind of give us an idea of what brought you in to see me and what was happening.
I pretty much lived on antihistamines and decongestants.
Mm-hmm.
I had a lot of facial pain right through here. My teeth, I'd go to the dentist saying my teeth are sensitive. Sinus headaches,
Mm-hmm.
lots of pressure.
Mm-hmm.
And probably the biggest thing was I would go somewhere on a plane and my ears didn't pop,
Mm-hmm.
so to speak.
Mm-hmm.
I would stay clogged for quite some time,
Mm-hmm.
and just about every time I flew, I came down with a cold or something or other.
How about nasal obstruction? Did you have that as well?
Yes,
Mhm.
I did have. I always didn't sound like myself. I
Mhm.
sounded like somebody who was in a barrel.
Yes. And what about, I remember you coming in saying you were having some drip in the back of your throat and stuff
The
like
drip
that?
in the back of my throat caused me to constantly clear my throat.
Uh-huh.
And as a tennis player, your opponents don't like you clearing your throat while they're serving or changing sides. It didn't bother them as long as they were winning. But if I was winning, it became a problem.
Got it. Got it.
They accused
got
me
it.
of doing it intentionally.
That is awesome. So we would typically treat you with an antibiotic and an oral steroid, which usually helps.
Yeah, steroids are great. They work.
Absolutely. Too bad we can't stay on steroids, right?
I would like that.
Absolutely. But it would help you. It would get you better short term.
Yes.
Right? And I guess the frequency became about every 3 months or so. And then after a while we got a CAT scan of your sinuses because we had done everything. We had done the nasal steroid sprays, recurrent antibiotics and steroids, got a CAT scan, and I remembered it showed your sinus. The good news was your sinuses, they weren't bad. It was just that where your sinuses drain, especially your cheek sinuses and your sphenoid sinuses way in the back, there was tightening where those sinuses drain. Besides that, you were pretty clear. So you just had some swelling right there. So I remember at that time, we had talked about maybe a balloon procedure to dilate your sinuses because you didn't need a big sinus surgery. You were a unique subset of patients that just had mild disease. So the way that I do the balloon procedure is patient will come in, they'll select some music, and we'll put on Pandora, and then we'll decongest their nose with a little decongestant. And then we put some numbing gel on a cotton patty and pass it in the front of their nose and let it sit for about 8 minutes. After 8 minutes, we remove it and create a little space in the nose. And then we put the patties back in for another 8 minutes. And after that, they're pretty much numb for the procedure. Then what we do is we turn down the lights and we have a little guide that has a light wire that goes through the guide. We'll pass the guide and aim it towards whatever sinus we're trying to open. For instance, the cheek sinus, and we'll pass the guide wire into the cheek sinus and it will actually light up the cheek sinus. So we're know we're in the right place. After that, we'll pass the balloon over the guide wire and dilate the balloon. So basically that sinus may be 1 or 2 millimeters open, and after we dilate the balloon, the bone reforms and is now 6 millimeters because the balloon's 6 millimeters in diameter. We leave it open for about 2 seconds and then we deflate the balloon and remove it. And now that opening is now 6 millimeters. And we'll do that for whichever sinuses we're trying to dilate. For instance, the frontal sinuses, the maxillary sinuses in the cheek, or the sphenoid sinuses, which are a little bit further back in the nose. So tell me how it was after the procedure, right after when you went home, and as far as pain and things like that. Tell me about it.
I went home and took a nap. I had taken a Tylenol, and that was it. Hardly any bleeding, no infections, no pain medication.
That's great. So overall, not a whole lot of pain.
No, there wasn't any pain.
Okay, gotcha.
No, not even, just a tiny, tiny little bit of dryness. And I think it was probably just healing.
Absolutely. And then we saw you a week later, because the medicine that we give you does create a little mucosal reaction. Basically, there's a little inflammation in the nose afterwards. And if you remember, we suctioned something out of your nose that first week afterwards. And how did that feel after we got that out?
That was fine.
Good.
It was fine. Once it's gone, it's gone.
Yep. That's great.
I don't remember. There was nothing afterwards that I could say was anything but ordinary.
Okay, that's great. That's great.
It was easy.
Okay, good. So overall, I guess one thing that I like to ask my patients is, would you have preferred for us to do this in the operating room, this particular procedure, or the way we did it?
Oh no, I would much rather do it in an office setting. An operating room is just a big trip to the hospital. You can't eat the night before. There's even more anxiety, I think, associated with going to the hospital.
100%. And I think it was awesome that you fit into that subset of patients. Again, because not everyone's so fortunate to have just that on a scale of 1 to 10, that kind of 2 or 3 that is the right patient for the balloon procedure. All right, so it's been 4 months since your procedure. Tell me what's changed since the procedure.
No sinus pressure, no
That's
pain.
great.
Flying is easy.
Awesome.
I don't take any antihistamines or decongestants. I stopped clearing my throat.
Wow.
I'm a quiet sleeper. It's just better. It's just easy.
That's great. And what would you say to someone that was kind of discerning? Should I get this? Should I not get this? What would you tell them?
Yes, you should.
Okay.
It was easy. Everything's been positive. I can't say there's not been one thing that I would reconsider doing.
That's great. Oh, well, thank you so much.
You're welcome.